Hello, I'm Steve Ronan. I'm a plastic surgeon here at Blackhawk Plastic Surgery. Welcome to BPS Live. Tonight, we're going to talk about blepharoplasty or eyelids, all things eyelids. Why would someone want to work on them? Well, the eyelids are a window to the soul. And so patients will complain of looking tired, having puffiness, extra skin, or hollowness, or dark circles, or various concerns regarding the eyes. So today we're going to talk about that. What can we do about it? Who's a good candidate for it? What's the recovery like? But before we get into all that, we're going to say hi to my co-host Brett and see if she has any announcements for tonight.
Before we get started, I just want to make sure we all are following us on social media and remind everyone to check out our before and after photos on there, learn about our latest specials, and don't forget to use our appointment scheduler. You can click the QR code on the screen, visit our website at blackhawkplasticsurgery.com, or call us 925-736-5757. Back to you, Dr. Ronan.
Thanks, Brett. All right, so let's talk about what is a blepharoplasty or eyelid lift. Well, first off, we have upper lids and lower lids. And so depending on which, we'll do different procedures. For the upper lids, typically that will oftentimes be associated with doing a brow lift, because as the brows come down, that creates fullness in the upper lids. And so it isn't always just the lid problem, it's oftentimes a brow problem. So we'll look at brows and then we'll also look at the lid. And with the lid, oftentimes there's extra skin and then extra fat, especially on the inner part of the eyelid. And that fat creates sort of some puffiness in that area. We also do Asian eyelids, which is a little different form of upper eyelids where the skin muscle layer connects down into the lid further down towards the eyelashes, which creates a little extra fullness in that area. And so a lot of our Asian patients will have us actually raise their crease or create a crease that's a little bit higher, and that will give a little bit more of a Western looking eyelid. We'll typically raise it a little bit, but not too much because we want to keep it very natural looking. With the lower eyelids, there's a variety of things we have, but most of the time it's due to volume loss in the face or hollowness in the lower eyelids. In addition, there can be laxity of skin, potentially the muscle, and also crepey skin or wrinkling. And so we'll create a procedure for each patient that will help with the lower eyelid rejuvenation, depending on what we see and how far along we are. What we intend to do is make the eyelids look fresher, younger, more open, but not scared looking or pulled or unnatural. We really want to just make you look like you feel and get rid of the sort of tired looking eyes. Your journey begins with a consultation. And in that consultation, we'll assess your medical history and make sure you're safe to have a surgical procedure. But in addition, we'll just look at your face and we'll find out kind of where you are in the continuum or the process of facial aging. And that'll involve looking at how much volume elasticity you've had, how much sun damage, how much laxity, etc. And based on that, we can develop a plan for your eyelids. And oftentimes that might include associated procedures. For example, upper eyelids are most often done with the brow. I see lots of patients who come in who previously had the upper eyelids done, but then tell me that they still have upper eyelid fullness, or they can't see very much change after having only their lids done. And those patients, when I lift the outer part of the brow up a little bit, it gives them the look that they always wanted in the first place. And so oftentimes upper lids done alone won't be enough. And so in those cases, we'll make a small incision in the scalp and elevate the lateral brow. And that kind of removes the hooding on the upper outer part of the lid region. And then the skin and fat is taken off the lid, which completes the result, which is a more open, less tired looking upper lid region. The lower lids are a bit more complicated. The genesis of the problem is loss of volume in the face or hollowing out. In addition, there'll be sun damage, wrinkles, crepey skin, and potentially excess or laxity of skin. And depending where you are on this process, we'll put together the right procedures for you. And that may be as simple as adding some fat in the form of fat grafting, which is a couple needle sticks, as well as laser resurfacing, which works on the wrinkles, crepey skin, and sun damage. In more advanced cases, we'll add the volume and do laser, but we'll also elevate the midface or the cheek to lift up the cheek and fill in the lower lid area. And when we do that, there'll oftentimes be a little bit of extra skin, which we can remove through a small incision under the eyelashes. Great candidates for blepharoplasty are people that are healthy, have some facial aging, and that's both men and women, typically in the 30s and up. As always at Blackhawk Plastic Surgery, we want you to look natural. And so we'll come up with a customized plan for you and your eyelids to make you look less tired, but keep looking natural. And some plans are bigger and some plans are smaller, and we'll share all of that with you at your consultation. I'm going to show you pictures of a few patients that have had less and more done as examples. Our first patient is a little bit earlier on in the aging process. If you look at her before and after globally, you'll just see that she looks a little more calm and rested and less tired. So what do? Well, we worked on her brow. We elevated that a little bit on the outside. We took some skin from her upper lid. Overall, when you look, you just kind of see across her eyelids a little bit more. It doesn't look pulled or tweaked or too much or surprised looking. She just looks very normal with less fullness in her upper eyelid region. When you look at the lower lids in the before, you can see they look a bit hollow. And so what we've done is some fat grafting to replace some of the volume that was lost. And that's done under the eyes and in the nasolabial folds and marionette lines, and also into the cheekbone. After that, we do some laser resurfacing, which decreases wrinkles, works on texture, and decreases brown spots and sun damage. Overall, it gives us a nice natural look. Patient looks more alive, more awake, more refreshed, but totally natural. Our second patient had a little bit more aggressive procedure, and so she had the same procedures as our last patient, but in addition, had her face neck done and also some skin taken from her lower lid. And so in this, you'll see that the volume of the cheek has moved upward so that it's less volume in the jaw area and more volume under her lid. It's the reverse than the before. When you look at her lower lid before, you'll sort of see some waviness and some extra skin there. And in the after procedure, you'll see that area has sort of filled up with volume, the extra skin is gone, and the skin is nice and smooth. Let's talk about the recovery associated with having a blepharoplasty or eyelid lift. Some of that is determined by the associated procedures that you might have. If it's just the lid, it's typically a week or less. If it's done with a whole face, then it's going to be about 2 weeks before you're back in public. The pain associated with eyelid lifts is actually very low, and that would include even really when you do the whole face. It's kind of shocking how little it hurts. Most of our patients are taking Tylenol and Motrin after the first 2 or 3 days. As far as return to work, that'll typically be in about 1 to 2 weeks in an office type setting, but working from home often begins very quickly. So that covers eyelid lifts. We hope if you have more questions that you would give us a call and come in for a consultation, see our 14,000 square foot facility with 2 ORs and lots of patient rooms and a wonderful staff. Now, we're going to turn it over to Brett and we'll begin our favorite part, which is the Q&A session.
Thank you, Dr. Ronan. We have some really great questions today. Let's start with Mark. He wants to know, what's the difference doing the lower lid incision on the inside versus the outside?
So that's a good question, Mark. When I was in training or a resident, which happens to be a lot longer ago than I would like, we used to do a lot of incisions on the inside of the lid. And the thought back then, which was wrong, was that patients had extra fat in their lower lids or fatty bulges. And lots of patients still come in and ask me about that. And so the thought back then was you could go behind the eyelid and pull out that extra fat. The problem was that led to more hollowness in the lower lid region. And so it was really the wrong thing to do. There's a very rare patient with tons of fat there that I think is appropriate for that procedure. But the vast majority of patients that come into my office are really suffering from a volume deficit of fat in their face. And so instead of taking out fat, we're adding fat, adding fat, adding fat. And then we'll do laser to work on the texture, wrinkles, crepiness of the skin. And if we need to take out skin, we can do that. But oftentimes we don't have to. And so you can still have a non-visible scar blepharoplasty by doing fat and laser for treatment of the lower lids.
I have one from Isabella. It sounds like a recovery question. How soon would I notice results, and how long does swelling usually last?
You might see your result right away going home, but oftentimes there's some swelling and bruising associated, and so it'll take a little bit of time for that result to develop. The amount of swelling and bruising are both variable with patients. Some patients will have very little swelling. Some patients will have a lot. Same goes for bruising. Most of our patients, after a week, the bruising will be mostly gone, and the swelling will still be there a little bit. If you're not doing fat grafting, we'll do some ice, and that can kind of speed up the process. It does take a little time to get to the full result, which typically is about a month or more.
All right. We have one from Jessica. I feel like my upper eyelids make me look tired all the time. Will surgery make me look more awake without changing how I look?
So the point of doing the surgery is to change how you look, right? So if you come in looking tired, we want to improve upon that. So we have to find out, well, what is making you look tired? Maybe you just didn't sleep. But for most of our patients that come in, they're well rested, and the tiredness comes from some hooding of the upper lids, which is oftentimes a little bit of brow ptosis and then some extra skin on the lid. And so, yes, we can deal with that and make you look normal, totally natural, but not tired looking.
Stephen wants to know, how do I know if I need an upper eyelid lift, a lower one, or both?
Good question. And so it'll start with a consultation. And rather than having you tell me which procedures you want, I'll ask you to tell me what's bothering you. What don't you like? Is it brown spots? Is it fullness? Is it wrinkles? Is it skin texture? And from that, we'll put together a plan for you to deal with the problems that concern you. And so oftentimes patients come in, I want a procedure, but that procedure doesn't fix what their concern is. And so we're going to put together a plan for you and review that. And if it's both upper and lower, it just might be. But if you're not concerned with lower lids and you're only concerned with upper lids, for example, then we'll just work on that part.
All right. Maria asks, is recovery really painful? How many days would I need to take off work?
Typically for eyelids, the recovery is fairly easy, and most patients would take at most a week off from work. If it's associated with other procedures that are bigger, like doing a whole face, for example, then typically most of our patients are back in public in 2 weeks.
Daniel said, I've heard scars can be noticeable. Where are they usually placed, and how visible are they after healing?
Typically for the upper lids, they're placed in the crease of the upper lid. And so if you close one eye and look in the mirror, you'll typically see a dominant wrinkle. And that's where we'll put the scar, because the scar will look like the wrinkle and is much less noticeable if it's in a good position. For the lower lids, you might not have a scar, or you could have a scar right underneath your eyelashes. And that typically also hides very well.
Catherine asked, what's the difference between a blepharoplasty and a brow lift?
Okay, so what's the difference between the eyes and the brow, or blepharoplasty and a brow lift? If you take your hand and you put it on your forehead above the outer part of your eyebrow and you do some lifting, that shows the effect of a brow lift. And so a brow lift is typically done to elevate the brow upward, maybe slightly outward on the outer part of the brow. one of the things we don't want to do is lift the inside of the brow. And so if you do that in the mirror, you'll see a very surprised, awkward look. And so we don't want to do that. Brows are the outer half of the eyelid area. The eyelid or blepharoplasty involves the skin that's underneath the brow but above your eyelashes. And so sometimes there'll be extra skin in that area, which we can remove, as well as little pockets of fat that are typically towards the center that create some sort of fullness or some bulging in that area.
I like Ethan's question. He wants to know, will people be able to tell I had surgery, or will it look natural?
Well, of course, we are always striving to bring about a natural result, but we do want you to look different. That's why we're doing the surgery. And so what should happen is you'll see some more space underneath your brows or less fullness in the upper lid region. And on the lower lid, you might have increased volume, a little bit less skin excess or less wrinkles, depending on what type of procedures that we do. But yes, we want you to look improved, but we also want you to look natural and like yourself.
All right. Here's one from Laura. I have bags under my eyes that no cream has fixed. Would a lower eyelid surgery help?
So that's a great question. And I would never expect a cream to fix that. Creams are for surface type things and therefore like cleaning off something. So like brown spots or, making your skin healthy, but they're not going to change the structure or shape of something. And so if you have large bags under your eyes, more than likely that's associated with enough facial aging and volume loss that we would need to add some volume and lift your cheek up and then also take out some of the skin excess. Sometimes if someone has larger bags, we only need to replace volume and do laser. But most of the time it'll be involved with elevating the cheek as well.
Brian says, how long do the results typically last?
You typically carry the results forward with you for the rest of your life. You can think of it like the clock turns back a certain number of years, and then it starts ticking from there. Certainly, as the years go by, you'll have more of an aging process for your face. You'll definitely have more volume loss, and sometimes we'll go back and add some more volume and potentially do laser again, many years later. But whatever benefit you get, you sort of carry that forward.
Sophia asks, can eyelid surgery improve vision if the skin is drooping over my eyes?
Yes. So if your skin is over your eyelashes, that can create a visual field cut or deficit. And so it can be that the skin won't allow you to see this area. If you're looking forward, it'll be sort of blocked. And an ophthalmologist can do a visual field test and kind of identify if there's areas that are blocked because of the skin.
Michael wants to know, am I too young for this procedure if I'm only in my 30s?
No. In fact, oftentimes blepharoplasty, the volume replacement, laser procedures are done on patients in their 30s and up, and really even some patients in their late 20s. I saw someone yesterday who came in and said, I have some hollowness under my lids and I feel like I look gaunt and I look like everyone else in my family. In addition, she said that her brows or her upper lids were really full. And I could tell by looking at her that it was kind of a genetic trait. And I asked her, I said, you really never had a good place to put your makeup, have you? She said, no. And said, a lot of people in your family have that fullness. And she said, yes, of course they do. And so there's certain people genetically that will come seek help from us for fullness in the upper lid region or volume loss in the face sooner than other people. And it's just people that were born with more fullness in that area, sometimes that's Scandinavian, or just more volume loss in the face.
Awesome. Speaking of makeup, Hannah asked, how soon can I wear makeup after surgery?
Well, it depends on what we do, but typically about 10 days out, you'll be good for makeup.
David says, what kind of anesthesia is used for eyelid surgery?
It's a great question. So most of the time that we're doing eyelid surgery, we're also doing other procedures. And so and most of our procedures are done with general anesthesia. So you would go to sleep, you wouldn't feel anything, you won't wake up in the middle of it. It's very calm. We can do the procedure in a really calm way. And I don't have to worry about you and your comfort and how things are going, because I have an expert that is doing that for us, and they'll take really good care of you while I do the procedure. And so I'm a big fan of using an anesthesiologist for virtually all the procedures that I do.
Olivia asks, can an eyelid lift be combined with other procedures like a facelift or laser resurfacing?
Definitely a good question. The answer is yes, that the vast majority of times we're doing eyelids, they are associated with other procedures. Upper eyelids, most of the time brow. Lower eyelids, typically fat, laser, and potentially the face as well.
Thomas wants to know, how long does the surgery actually take?
Well, it really depends on what we're doing. So just simple upper eyelids will take 30 minutes or less. If I do someone's whole face, it'll probably take 3 or 3.5 hours. And so it just depends on what else we're doing with the eyelids.
Anthony says, I do a lot of exercise. How soon can I get back to the gym?
Good question. So it really depends on what we do again, but most of our patients at 3 weeks are totally unrestricted with low impact aerobics, and at 6 to 8 weeks can begin more vigorous activities. But as far as going for walks or long walks or very low impact type things, most of our patients will begin that after 1 or 2 weeks.
Time for one last question. We'll take Emma's. Do men get eyelid surgery too, or is it mostly women?
Both men and women get eyelid surgery. Probably 10% of the eyelids we do are for men.
All right, that's it for questions. If you have any questions, feel free to email me at info@blackhawkplasticsurgery.com or call at the office at 925-736-5757. And if you'd like to schedule a consultation and talk about blepharoplasty or some other procedure, click the QR code on the screen or visit our website at blackhawkplasticsurgery.com. Back to you, Dr. Ronan.
Well, thank you all for tuning in tonight to our BPS Live, talk about blepharoplasty. They're fun procedures to do, and they make a really nice change for patients. And as always, we want to keep you looking natural. So we hope to see you soon. Feel free to come see us for a consultation. Thank you so much for tuning in to BPS Live. On this patient, we had a complaint that he can't see and no one can see his eyes because there's so much going on. And so what we recommended for him is to get a haircut. And that's going to happen this Friday. And the poor guy should be able to see a lot better. Huh, Tahoe? Huh, buddy? At any rate, he does have eyes underneath there.